Welcome to the Heartland Continuum of Care's Community Street Outreach Standards and Best Practices Training. The purpose of this street outreach training is to improve service coordination and collaboration of agencies, to better respond to the needs of people experiencing homelessness across agencies serving the unsheltered population by establishing a shared understanding of what street outreach looks like, how it should be conducted, and what desired outcomes are across all organizations. This training will also highlight other goals of street outreach, which include services delivery alignment, meaning street outreach efforts should be centered around community alignment, meaning consistent outreach collaboration, increased coordination and communication between community partners, while trying to avoid duplication of services. Consistent documentation of service delivery, because we believe recording well-documented and standardized information will help future outreach workers find and engage with unsheltered persons, determine how much time to spend in the field, and understand what data and coordination expectations they will need to meet. This ensures that quality data is being captured. And system coordination. Communication will be improved and strengthened for street outreach staff from across organizations to work together instead of in silos. We know that transparency within the community and across street outreach workers about the expectations for street outreach efforts ensures equitable treatment for all unsheltered persons and accountability for all agencies. Every agency should understand the services that can be offered by other agencies and will trust that all agencies are similar in how they provide care. Heartland Housed will be able to evaluate and improve how the local homeless response system is working to meet the needs of clients affiliated with street outreach efforts. What is the Heartland Continuum of Care? Well, the Heartland Continuum of Care is a collaborative network of organizations, agencies, and individuals working together to address homelessness in Springfield and Sangamon County. Its primary role is to coordinate and implement a comprehensive system of services and housing options for individuals and families experiencing home insecurity. Street outreach in Springfield and Sangamon County is defined as professional homeless services intervention that focuses primarily on supporting individuals with accessing shelter, resources, and/or permanent or temporary housing, depending on the needs of the client, by building trusting relationships and ongoing rapport. Street outreach seeks to engage individuals living unsheltered in a culturally competent and trauma-informed manner, provide connection to appropriate services, and use diversion and problem-solving techniques to connect people with safe shelter and/or housing options whenever possible. The primary goal of street outreach is to facilitate a higher level of care for unsheltered members of the community with access to voluntary wraparound services needed to stay healthy and stable, including substance use treatment, mental health care, medical services, ID recovery, benefits, and employment. When we talk about homelessness, we all must understand that it is a complex and multifaceted issue characterized by the lack of stable, safe, and adequate housing. It encompasses a range of situations where individuals or families do not have a place to call home, leading to a variety of challenges and vulnerabilities. Here are some of the forms homelessness can take. Street homelessness. This is perhaps the most visible form, where individuals or families live in public spaces such as parks, sidewalks, or abandoned buildings. Sheltered homelessness. While individuals experiencing this form of homelessness may not be living on the streets, they rely on emergency shelters or temporary accommodations for housing. Unsheltered homelessness. This refers to individuals or families who lack any form of shelter, often living in makeshift encampments, vehicles, or other uninhabitable places. Hidden homelessness. Sometimes referred to as couch surfing, hidden homelessness describes individuals who do not have permanent home and may stay with friends or family temporarily, often moving from place to place. Chronically homeless. This term refers to individuals who experience long-term or repeated episodes of homelessness. These various forms of homelessness highlight the diverse, interconnected issues that contribute to housing instability, including economic hardship, lack of affordable housing, mental illness, substance abuse, domestic violence, and systemic inequalities. Addressing homelessness requires comprehensive strategies that encompass housing assistance, supportive services, and community engagement to provide stable and sustainable solutions for those in need. After briefly touching on the many issues that can cause an individual to experience home insecurity, it's important to emphasize that leading with empathy, compassion, and understanding is paramount when working with homeless individuals. Compassion and empathy are both necessary for effective engagement. It is important that street outreach workers engage and support unsheltered people in an equitable, kind, and fair way, ultimately seeing the relationship as a joint partnership. Street outreach workers shall demonstrate empathy in each encounter with an unsheltered person. Please remember that experiencing homelessness can be extremely traumatic for individuals. What is trauma? Trauma is a deeply distressing or disturbing experience that overwhelms a person's ability to cope. It can be caused by various events such as accidents, abuse, violence, natural disasters, or even loss of a loved one. Trauma can have lasting effects on a person's physical, emotional, and psychological well-being, often leading to symptoms such as anxiety, depression, nightmares, flashbacks, and difficulty trusting others. Trauma can affect individuals differently, and its impact can vary depending on factors such as severity of the event, the person's resilience, and their support network. A trauma-informed approach is a way of understanding and responding to individuals that acknowledges the prevalence and impact of trauma, and involves recognizing the signs and symptoms of trauma. Homelessness itself can be traumatic, and individuals may have experienced additional traumas such as abuse, violence, or loss. Creating safe environments. Outreach efforts prioritize creating safe and supportive environments for interactions. This might involve meeting individuals in locations where they feel comfortable, or providing access to safe spaces where they can share their experiences without fear of judgment or harm. Building trust. Establishing trust is a crucial aspect of trauma-informed outreach. Workers aim to build trusting relationships by being reliable, respectful, and non-judgmental. They understand that trust may take time to develop, particularly for individuals who have experienced betrayal or mistreatment in the past. Empowerment and choice. The approach emphasizes empowering individuals to make their own choices and decisions regarding their needs and goals. Outreach workers offer information, resources, and support, but ultimately respect individuals' autonomy and agency in determining the path forward. Sensitivity to triggers. Outreach workers are mindful of potential triggers that may re-traumatize individuals. They strive to avoid language or actions that could be triggering and are prepared to respond with sensitivity and compassion if a person does become distressed. Collaborative and holistic support. Trauma-informed outreach recognizes that addressing homelessness often requires a multifaceted approach. Outreach workers collaborate with individuals to identify their unique needs and preferences and connect them with appropriate services such as housing assistance, mental health support, substance abuse treatment, and health care. Street outreach workers should always lead with kindness and compassion, while always clearly identifying themselves, the organization they work for, and their intention. Organizations and individuals capturing data with the community outreach tool must receive explicit consent from any individual from which data is being collected. Building trust and rapport are necessary for effective engagement and are often built over time. It may take multiple months, weeks, and years of engagement, before individuals accept any service. Examples to building rapport. Consistent presence. Show up regularly and be visible to the individuals you are looking to work with. Consistency demonstrates you are committed and reliable, which can help build trust over time. Initiate conversation. Approach individuals in a friendly and non-intrusive manner. Greet them warmly and engage in casual conversation to get to know them. Ask about their day, interests, or any topics that they seem comfortable discussing. Active listening. When individuals share about their experience or concerns, listen attentively without judgment. Validate their feelings and experiences by acknowledging them emphatically. For example, if they mention frustration about their living situations, you might say, "It sounds like you're going through a tough time. I'm here to listen if you want to talk about it." Respect boundaries. Respecting an individual's boundaries and avoid pressuring folks to disclose more than they are comfortable with is very important. Let them lead the conversation and share at their own pace. This demonstrates that you respect their autonomy and trust their judgment. Offer support. Offering tangible support based on their needs and preferences. For example, if they mention needing warm clothes, offer to help them find nearby options from a clothing donation center. Follow up. Check in with them regularly to see how they're doing, whether they need any assistance, and try to remember details from your previous conversation to show them that you care and value the relationship. For instance, if they mention having a doctor's appointment, ask them how it went, or if there's anything you can do to help. Be patient. Building trust takes time, especially with individuals who may have experienced trauma or distrust in the past. Street outreach workers are to communicate with individuals in ways that use plain language, are clear and concise, and appropriately articulate action steps. One crucial aspect of nonverbal communication skills is body language. By being aware of your own body language and observing the client's cues, you can establish a positive and empathetic connection. Ways to do this include maintaining an open posture, making appropriate eye contact, and being aware of the tone, volume, and rate of speech of your voice. Other nonverbal communication examples. Eye contact. Maintaining appropriate eye contact shows that you are attentive and engaged in the conversation. It demonstrates that you are actively listening and interested in what the other person is saying. Facial expressions. Expressing warmth and concern through facial expressions can convey empathy. For example, a gentle smile or concerned furrowed brow can indicate that you understand and care about the other person's feelings. Nodding. Nodding occasionally while someone is speaking shows that you are actively listening and processing what they are saying. It encourages the speaker to continue sharing their thoughts and feelings. Posture. Leaning slightly forward and facing the person directly demonstrates openness and attentiveness. Avoiding crossing your arms or legs can also signal that you are receptive to what the other person is saying. Mirroring. Subtly mirroring the other person's body language can establish a sense of connection and rapport. This could include matching their gestures or adopting a similar posture. Using these nonverbal cues in tandem with verbal cues such as, "I understand," "I can't imagine how that made you feel," "That must have been really difficult," "I'm here for you," can complement nonverbal communication and reinforce your empathy and understanding. Another important aspect of meeting others is cultural humility. It encourages us to approach other cultures and people with an open mind, respect, and willingness to learn. It involves recognizing that everyone has their own unique cultural backgrounds, beliefs, and experiences that shape who they are. Instead of assuming that we know everything about someone else's culture or that our own culture is superior, cultural humility teaches us to acknowledge our limitations and biases and to be curious and respectful when engaging with people from different backgrounds. Motivational interviewing is a client-centered approach aimed at helping individuals explore their readiness for change. It involves engaging them in non-judgmental conversations, guiding them to identify their own motivations for positive change, and supporting their autonomy in making decisions about accessing services and addressing their housing needs. This method respects the individual's right to self-determination and focuses on empowering them to take steps towards improving their situation. Here are a few ways to apply motivational interviewing techniques in street outreach. Always continue to build rapport by showing authentic support in every interaction. Exploring ambivalence. Many individuals may have mixed feelings about seeking assistance or making changes in their lives. Motivational interviewing allows outreach workers to explore these conflicting feelings in a non-confrontational manner, helping clients to identify their own motivations for change. Eliciting change talk. Through skillful questioning and active listening, outreach workers can encourage individuals to verbalize their desires, reasons, and intentions for making positive change in their lives. This change talk can strengthen their commitment to taking action. Supporting self-efficacy. Motivational interviewing aims to enhance clients' belief in their ability to change and overcome obstacles. Outreach workers can provide encouragement, affirmations, and practical support to help individuals build confidence in their capacity to address their issues. Collaborative goal setting. Instead of imposing goals on individuals, motivational interviewing encourages collaborative goal setting. Outreach workers can work with clients to identify and prioritize their own goals related to housing, employment, health, and other important issues. Some individuals may refuse support, and that's okay. Let them know that you are there if anything changes. In some instances, outreach workers will engage with someone who is not ready to access housing resources or even discuss the idea of being housed. Outreach workers should utilize progressive engagement like motivational interviewing techniques, which customizes the level of support and focuses on the individual based on their assets and strengths. Assertive engagement involves being persistent when trying to connect with individuals who might not want help. Through building a deliberate, trusting relationship and offering information or practical help, like finding shelter or health care, and support to set and achieve goals for getting back on their feet. Consistent checking in to make sure the person is okay and getting the help they need. Ultimately, street outreach staff shall not coerce, force, bribe, trick, or bargain with unsheltered persons to get them to accept housing. Resources and housing should be driven by client choice. Street outreach staff are responsible for maintaining current knowledge of available resources to the unsheltered population in Springfield and Sangamon County more generally. Please always try to provide a printed copy of the Heartland Housed Resource Guide or offer the website heartlandhoused.org and click Need Resources. Whenever referring an unsheltered individual to another street outreach staff or any other staff or program from the same or different agency, all reasonable efforts shall be made to ensure that there is a complete and transparent sharing of information as well as a warm handoff. Warm handoffs occur best when all relative parties, including the unsheltered person, are in the same location and are sharing information transparently. The pathway to housing within the Heartland Continuum of Care requires the utilization of coordinated entry systems, which is a process developed to ensure that all people experiencing a housing crisis have fair and equal access and are quickly identified, assessed for, referred, and connected to housing and assistance based on their strengths and needs. Households that are eligible for coordinated entry are literally homeless, at imminent risk of homelessness, or fleeing or attempting to flee domestic violence. The coordinated entry process is designed to fulfill three primary purposes: to consolidate and streamline the community-wide process by which individuals experiencing homelessness can request assistance in regaining permanent housing, to create a system that identifies a pathway to permanent housing for all individuals experiencing homelessness, including creating one where it does not yet exist, and to ensure that whenever a program has insufficient capacity to serve all consumers in their potential service population, the most vulnerable individuals experiencing homelessness are served first. To ensure that proper intake and assessment of any housing services is completed for either a family, individual, or youth, the Heartland Continuum of Care has identified multiple coordinated entry access points and are shown below. The Coordinated Entry Assessment is a screening that will be completed using an assessment tool that determines a client's eligibility, needs, barriers, and strengths. Coordinated entry referrals prioritize those individuals and families who are most vulnerable according to the place value housing scoring model, as well as those identified as meeting the HUD definition of chronically homeless. Prioritization, based on the priorities by the Heartland Continuum of Care and the Coordinated Entry Assessment, individuals and families placed on a priority list. Clients are matched and referred to service providers for appropriate housing that meets their needs. Thank you for participating in the street outreach training provided by the Heartland Continuum of Care. We are so grateful that you are committed to making a difference in the lives of people in our community. If you are currently participating in outreach in our community or are interested in doing more, please reach out to Jamie. Please visit heartlandhouse.org. Are there resources that aren't listed on our website that are being provided in our community? Please let us know. We have a constant growing and changing resource list, and we need your help to keep it up to date.